Hello, California Policy Advocates. This is Menard with the National Resource Center on Domestic Violence, and Krista asked me to lift up some of the things that are on a part of our national economic justice agenda to inform some of the conversations that you're having together in California. I want to start with the intersection of domestic violence and poverty because it's real and it's urgent. We know that domestic violence and poverty exacerbate each other. Significant numbers of women living in poverty are also dealing with domestic violence, and that makes it difficult for them to climb out of poverty, sometimes making that impossible. Poverty, in turn, can make it more difficult for abused women to escape their violent relationships and or make it difficult to recover from the impacts of that domestic violence. So just wanted to make sure that we all had that as a backdrop. So in 1996, 20 years ago, the federal government enacted sweeping welfare reform legislation that created the Temporary Assistance for Needy Families, or TANF program. In California, it's called CalWORKS, as I'm sure you all know. Under TANF, the federal government provides funding to states, and each state then develops its version of that program. States must comply with some federal requirements, such as time limits, such as work requirements, as part of receiving benefits, also including cooperation with child support enforcement, as well as other rules. But each state gets to define who is eligible for their TANF program and determines the amount of assistance that are provided to families and other rules. All states have adopted the family violence option, in which they certify that they will screen and identify domestic violence victims that are applying for or receiving TANF benefits, refer those victims to services, and waive requirements such as time limits or child support cooperation requirements if those are found to increase danger or make it more difficult for them to escape violence. TANF, the TANF legislation that sets the funding, authorization, and the outlines of the program expired on September 30th, 2010. And so what's been happening since then is Congress has basically just continued the program on a year-by-year basis. They've not increased funding, including during the recession, and they've not taken up the opportunity to change some of the more problematic provisions of TANF, which have been found not to reduce poverty in any way and actually make things difficult for poor families. In 2009, Legal Momentum and the National Resource Center on Domestic Violence conducted a national survey of domestic violence advocates and legal aid attorneys or agencies to explore what they were seeing in terms of the experiences that domestic violence victims were having as they tried to access TANF and child support. We titled the report that reflected the findings of those 600 individuals who responded to the survey. We called it "Not Enough: What TANF Offers Family Violence Victims." There were three key findings from that survey, and again, we had respondents from all 50 states and the District of Columbia. 96% of respondents underscored that TANF is an important safety net program that is really important to domestic violence survivors. The second finding is that TANF can make a significant difference when it works well, and there were certainly examples of when the TANF agencies and advocates, domestic violence programs, other community agencies work together to really create safety and provide economic support to survivors. But the third finding was the one that was most significant, that TANF can also make a significant difference when it does not work well. And it does not work well based on the respondents for the majority of domestic violence survivors that they were seeing in their advocacy or legal practice every year. It wasn't working for a majority of survivors because the benefits were too low or they were delayed, so it didn't really function as a safety net for someone that was trying to escape a violent relationship. How TANF workers explore domestic violence issues or safety risks was ineffective or missing. Disclosures of domestic violence did not necessarily lead to something helpful or protective or something that increased survivors' economic self-sufficiency. And in fact, some responses from the TANF system made things worse. Some of the things that they were asked to provide, to document domestic violence, put them in increased danger, or in fact made it more difficult for them. So that's again another context, and we hope that there's an opportunity for us to influence a reauthorization of the TANF bill and make some improvements. And we need to be ready for that. We are talking about redoing that survey to update our sense of what the experiences are out there across different states. We anticipate that there has been some erosion of some of the relationships between TANF agencies and domestic violence programs in the recession, where both of those both of those systems were affected by state level funding cuts in particular. So yesterday, you probably heard, the Census Bureau released its annual report on poverty, income, and health coverage, health insurance coverage. The good news was that the rate of poverty has dropped from almost 15% in 2014 to 13.5% in 2015. So that's good. And it also reports that there's been a dramatic increase in the number of families that now have access to health insurance, although there's still an enormous number of families, 28 million families, who still do not have access to health coverage, so that's a problem. But there's some other stories. In addition to that, generally good direction, but we could be doing more. And the reality is that 1 in 5 U.S. children is poor. And that racial and ethnic minority children are disproportionately poor. In fact, 1/3 of black children and almost 1/3 of Hispanic children live in poverty, compared to 12% of non-Hispanic white children. So poverty is still disproportionately burdensome on poor families, even in families that have an adult who is working. So working at low-wage jobs, often part-time on part-time basis, is not helping to lift the families out of poverty, and that's a real problem. Young women ages 18 to 24 are poor at higher rates than young men. I don't think that would surprise us. That's also data from the census. And young adults ages 18 to 24 at high risk of poverty. 1 in 5 young adults lives below the federal poverty line, one of the highest rates of any age group. So this is a group that is particularly at risk. 1 in 4 U.S. young parents under 30, is poor. So there's clearly a great deal of work still to be done. And I'm providing to Krista some of the analysis of the poverty data, including an infographic that the Center for Law and Social Policy prepared on what poverty looks like in 2015. So what can we do? There's lots that we can do. The Center for Law and Social Policy, again, one of our partner anti-poverty organizations, has identified 5 bold steps that would go a long way towards turning around child and family poverty, and also address some of the systemic barriers that disproportionately impact families of color. These 5 bold steps that I'm going to just quickly review track pretty closely to the recommendations that we heard in 2009 from domestic violence advocates and legal aid attorneys who were responding to our Not Enough survey. So there's some real synergy there. So the first recommendation that the Center for Law and Social Policy puts forward is that we invest in affordable and high-quality child care for all low-income families. So parents can work and children can thrive. That was also, again, referenced by the respondents to our Not Enough survey in 2009. The second area of policy advocacy is working to ensure a substantial jobs agenda, which provides opportunities for low-income workers to earn living wages and gain skills on the job, including a substantial investment in subsidized summer and year-round employment for youth and young adults. The third is financial access to post-secondary education for all low-income students, including both youth and adults, so that they can get the credentials they need to succeed at work. Their fourth area of policy opportunity is access for all workers, including low-income workers, to paid family and medical leave, earned sick days, and fair schedules, work schedules, so parents don't have to trade off their child's health and well-being to succeed on the job. And the fifth is improvement to the safety net that fills gaps and builds on the proven success of safety net programs like the Earned Income Tax Credit and other programs, including by extending EITC to low-wage adults without dependents, so that would include single battered women, and young adults. So those are 5 recommendations, again, that track very closely to what we heard from survivors, some advocates working directly with survivors, and that we expect to hear again as we design the next iteration of the Not Enough survey. So clearly, I guess the last point I would leave you with is that clearly anti-poverty work is domestic violence advocacy work. And there are many groups organizing around both anti-poverty efforts and income inequality issues that are ready to welcome us as partners if we're not already partnering with them. So thanks a lot. Thanks for listening. And again, I've shared with Krista some resources that kind of support and extend some of the things I've talked about. Take care.